Welcome to our Global Alliance for Disaster Resource Acceleration Town Hall. My name is Megan Lang, and we would first like to announce that we are recording this webinar. It is also currently being live streamed on WID's Facebook page, which is facebook.com/World Institute on Disability. And we have put the link in the Zoom chat. For starters, everyone has been muted. You can activate captions on your toolbar located at the bottom of the Zoom window, or use the URL we just put in the chat box. And I see that has been put there. Lastly, we do hope you will share and tweet about this WID Town Hall listening session and the very important issues that you will all raise today. We would love it if you used hashtag Disability Disaster Alliance on the various social media platforms. I think that's all the housekeeping, so let's get started. I will turn it over to Priya Penner, who will kick us off.
Thank you so much, Megan. Hello and welcome, everyone. My name is Priya Penner, and I'm with the Partnership for Inclusive Disaster Strategies, as well as with GADRA. My pronouns are she, her, and I am a brown woman with curly black hair. Today, I'm wearing a pink shirt and a red cardigan, in addition to my black over-the-ear headphones. So welcome once again to the Black Disabled Global Disaster Experiences Action Strategies webinar. We're so excited that you're here today to continue this conversation with us. This is a continuation of a previous conversation and previous panel that we held in February that I do hope that you all were able to attend. During that event, we discussed the experiences of Black disabled individuals all across the globe from different perspectives of our 5 panelists, Anita Cameron, Diko Yusuf, Kaman Kelly Wassop, and Vivian Isabor, as well as Leroy Moore. These 5 panelists had a great discussion on the roots of what they believe to be the roots of the issues that Black disabled folks are experiencing around the globe when experiencing disasters. They touched upon lack of resources, specifically financial resources, the lack of education, specifically for people with disabilities and Black individuals with disabilities. We also discussed how integrated and systemic the ableism and discrimination and racism were. So we had a really in-depth conversation in February on the roots of the issues that Black disabled individuals face when experiencing disasters. I do hope that you go back to the GADRA Facebook page or Twitter page to review that post-production as it is archived for folks to review. So you can have an idea of what that first conversation really looked like. Today, the conversation is going to be centered on how do we move forward? How do we take what we learned from the first session and continuing that conversation so that we can address these issues? As I previously mentioned, we have 5 amazing panelists with us today. That's Anita Cameron from Not Dead Yet, who is based in the United States. Her pronouns are she, her, hers. Diko Yusuf, who is with the Special Needs Initiative for Growth based in Nigeria. Their pronouns are he, him, his. We have Leroy Moore from Crip Hop Nation, who is also based in the United States. His pronouns are he, him, his. Vivian is with us as well from ADHD Babes, which is based in the United Kingdom. Vivian's pronouns are she, her, hers. And finally, but certainly not least, we have Kaman Kelly Wassop from Papua New Guinea, the Assembly of Disabled Persons and PNG Blind Union. And that, of course, Kaman's with Papua New Guinea. Kaman prefers to have their pronouns as their name. And so we are going to run, we are going to go ahead and get started. We have the first question, which is, I'm going to start off with Anita, which is, how do we address the roots of these issues? Anita, we had this amazing conversation last time, and you really discussed in depth the resources or lack thereof for disabled Black individuals in the United States and all across the globe. How would you suggest that you really address that root of the issue?
Thank you. Hello, everyone. My name is Anita Cameron. Quick description: Black woman, long dreadlocks, sky blue shirt with a globe and various people with disabilities on it, and the shirt says Disability Pride. Well, certainly there is the issues of of ableism and disability discrimination, the lack of access to resources, the lack of funding, the and for me, also the lack of the effective, for lack of better words, use of someone's talents. So, that, the problem is a lot of times, as Black disabled folks, we're not at the table, so to speak, or on the ground floor. And when we are not, we're either underutilized or overutilized, or tokenized. And so we really have to, and it stems from this kind of inequality and equity, and so we really, for me, those are the roots of the problems. They're not all, but it's certainly the ones that I see a lot in my experience.
Wonderful. And can I ask you to elaborate on the resources and how the resources could really, address the roots of the inequity in these experiences with disasters?
Well, I think, so often between being disabled and being Black, we're seen as lesser, and so the talents that we may bring, into the picture, aren't utilized, because people are so busy dealing with their emotions of, I don't really want them around, or do we really need to have them, or do we really need to listen to them, because so many individuals, agencies, entities, don't really want to hear from us, if you will, or think that it's okay not to hear from us, that they'll make the decisions for us. And that clearly does not work. And so what ends up happening is I've been in situations where, okay, so we're allowed to participate, but the environment is so toxic that it drives us away. We don't want to, we don't want to deal with that. Or people are so in their heads, with this attitude of what value that they have, that they just, kind of dismiss, what we have to say, don't really listen, talk over us, and all of that. So that's what I mean by, as far as people resources, human resources, that's a failure to, effectively utilize people's talents and gifts when you're so busy in your own ableist, or racist views, and in your minds questioning, what we have to bring, then it causes you not to want to effectively utilize that. So, people have to sit with themselves, breathe, and know that if you're talking about disabled and disabled Black people, the experts on this are disabled and disabled Black people. And so deal, and that's the problem with disaster. In disasters, disabled people and Black folks, we die needlessly. You know, we die when there's no reasons we should be dying, because because of ableism, because of racism, because often we are poor and we don't have access to, the things that wealthier communities have. And so, folks need to sit with us, listen with us, listen to us and work with us. Take our suggestions because we're the ones that know. Thanks.
Wonderful. Thank you so much, Anita. That is so important to hear. Deco, I'm really curious to hear your perspective on this question. And again, that question is, how do we address the roots of, these issues that we've previously discussed? And I'm really curious to hear your response from your corner of the world.
I'm Deco Yusuf, a Black male wearing a pair of glasses and got black hair, short hair, cut low. And it's good that you say from my part of the world, because I do consider that some of the problems that we have in Nigeria can be a little bit, not in the same way relatable to the ones that you might have in the US or in the UK, or even in Papua New Guinea, where Kaman is from and is part of us today. Personally, I think it's very important to pick up from the last question that was asked in the last conversation that we had, which was about the disaster cycle. So this is a cycle. I mean, that's something that is very key to remember. If the cycle is not broken, if that continuous recurrence of this kind of situation that we find ourselves in is not broken, it's not stopped at some point, it's going to keep happening, right? So the way I see it, we cannot always keep taking reactive measures every time there's a disaster. We have to make sure that disaster response does not start when disaster strikes, because this is almost the thing that happened with the COVID-19 pandemic. And I hear this a lot. I mean, whenever I'm in a conversation where people are discussing the pandemic, they say, well, it's an eye-opener, right? They keep saying it's an eye-opener. But before the pandemic, remember, we had several other disasters. Why were they not eye-openers? So I think, for me at least, the best way to address the roots of the problem very important, is to make sure that when we learn from current events, and we're in the middle of one right now. We're at the height of this problem right now. So what I think is very important is to learn from the problems that we have seen during this pandemic and even during previous disasters, and to make sure that they're integrated into the next disaster planning preparation, for subsequent disasters that probably, will come. And I think most global people who know stuff and predict stuff would say, yeah, sure, one will always be around the corner, so we'll be better prepared.
Wonderful, thank you, Deco. I really resonate with that, and I know many others, both on the panel and in attendance, really do as well. So thank you for sharing that. Vivian, I want to turn to you because I know last session we talked about, specifically you talked about education specifically for Black disabled individuals. And I think that really connects nicely with Deco's point. And I want to hear from you in your little neck of the woods over there in the United Kingdom, what your response is to this question.
Thank you. So hi, I'm Vivian Isabel. I'm wearing a blue headscarf and blue t-shirt with a black necklace. So I guess I think I agree with what's been said already, kind of being preemptive and not kind of being reactive to things that happen, because if you're already on shaky ground and then something shakes you, you're more likely to fall even harder. So I think having that foundation to start with is really important. So I guess here in the UK, we have really clear statistics that show the Black community have poorer outcomes across the board. So we look at the education system where, you know, before the age, I think it was 5, Black children, especially Black girls, do really well. And then beyond that, you start to see that there's a dip in how well we do. And we think that that's linked with how teachers treat us and how we're viewed within society. You start to realize your race, and that starts to impact you. And then you have what we call PRUs, which is a pupil referral unit for students who might be permanently excluded. And there's a really high correlation between going to those PRUs and then ending up within the prison system. So a lot of young Black boys are kind of excluded, or they're seen as, you know, disruptive, and it's kind of kickstarts a really negative route for where they go in the future. We look at employment, we have the same difficulties where a lot of people who are Black might express discrimination within the workplace, or there's higher statistics for us being unemployed. And then you look at mental health difficulties in general, and there's poorer outcomes in regards to psychosis, in regards to getting support and talking therapy. And even within just general healthcare, there's a lot of difficult statistics that show that people from the Black community, especially Black women, aren't listened to and believed when they're in pain. So there's a lot of different aspects to how difficult it is to be Black in Britain. And then when you now add that all on top of a pandemic that just for a general person is going to be difficult, it just makes recovering from that and even just sustaining that really difficult. So I think to address the root of the problem, even though it's such a wide spectrum, I think it is kind of looking at those wider difficulties. How can we kind of address all these different obstacles that are put in front of Black folk as they're going through life, and how can we kind of safeguard them against those things? And I think community services do that really well. I know that for me, managing to get through school was because we had things like the Duke of Edinburgh program where we were taken camping, and we were taught about Black history, and we had loads of things that intersected all the difficulties that we were experiencing. And again, it's difficult because funding for these things have been cut over the last 5 to 10 years. So I think, yeah, it's about addressing those kind of all those multiple things that are getting in the way of us having a good quality of life, and pouring money and resources back into the communities that are providing these safe spaces for people to recover from what we're having to experience just for being Black. So yeah.
Thank you, Vivian. Yeah, that's a very important perspective. We all know that education, specifically for disabled Black folks, is simply lacking. And that absolutely does contribute, as you said, to the perpetuating nature of the inequality within the disaster cycle. So thank you really so much for that. Kaman, I'm going to turn to you because I'm really curious to see your perspective and hear your perspective on how we address the roots of these issues in your corner in Papua New Guinea.
Yeah, hi, Kamanis. Yeah, I'm wearing a black glass sunglass. Yes, I think I just want to just build on the conversations with which the other panelists has alluded to. I think we've been discussing about some of the issues faced with Black disabled people. In Papua New Guinea, it's a country, it's a black country, so pretty much all our issues sometimes can be similar, sometimes it's not similar. So some of the things that we've been seeing, it's the lack of capacity that that support us as persons with disability to carry out advocacy. It's not really there. So sometimes, international donors or partners, they know that persons with disabilities organizations are on the ground to carry out things, but yet they use the other sources internationally to come down to the ground to implement programs and activities subjected to the whatever disaster that is. So that's one of the challenges that we face. But going on to the question that we are discussing right now, I see, just building on from the other panelists, I see the importance of, you know, identifying, you know, where are we in terms of our participation and engagement in driving inclusion forward, to be on the table or to discuss or to put some of our issues forward for them, or to participate in discussion and decision-making process and all of that. So where are we and how do we get there? So it's good to identify, you know, it's good to identify some of the barriers that is, you know, creating, limiting our opportunity, our chances to, you know, be on the table, to participate. So once when you identify the barriers, whether it might be systematic barriers, or it might be, you know, attitudinal barriers, or it might be some institutional barriers that is causing problems for us to, as Black people, to be on the table to discuss. Once when we identify barriers, now it can give us a opportunity to put the steps together, strategies forward together, mechanisms forward together to strive forward to, you know, to be included. So my point here is just building on the panelists' discussion forward, is to just to identify the barriers and how we can get there, how we can remove the barriers that is causing us to participate effectively on equal basis with others, despite, you know, our despite if we are Black, or despite our region, or, you know, our colors, skin colors, or disability as well. So that's how I see it. Thank you.
Thank you, Kaman. Thank you so much for your perspective. It's so important to recognize that, you know, recognize the barriers and realize that we can't move forward and address the roots without that initial identifying the roots and the barriers. So thank you. Leroy, I'm going to turn to you with our next question. And I know last session, the session in February, we had discussed together, and you had mentioned specifically the lack of financial resources and lack of financial support for Black disabled leadership. So I'm going to turn to you and with this next question, which is, how can other leaders best center Black disabled leadership in local, national, and global emergency management, planning, response, and recovery?
Okay, thank you for having me here. I'm a Black man, so I'm here with Leon. So I'm gonna be honest. So, you know, we can talk about how to get people involved, but it doesn't make sense to get people involved when our government doesn't implement our laws. So we had Joe Biden that, you know, ran for president, and had a disability campaign, and said that, you know, fully fund IDEA's individual disability education plan. That law has been in the book since 1975. So he just woke up one day, he's like, oh, we should fully fund this. The thing is that we have laws on the books that are not fully implemented, that are not fully funded. The same thing in the UK. The UK does studies after studies after studies on Black disabled people. You know, forget the studies, it's called implementation. So we can have people come and support our group and do activism all day and place on Sundays. But if the government is gonna not implement our laws, then we're F out. So we need to really put pressure, and this goes back to the UK too, to put pressure on these governments to implement our laws, because if we don't have that, then we don't have nothing. It's just a piece of paper. So we can advocate until next Christmas, but we need our government to really implement and really fully fund our laws. But I can keep on saying that the IDEA is not fully funded, and that goes to education. So if you can't get an education, then you can't get a job, and you can't get a house, and you can't. So it's a trickle down effect. So that's my, let's pressure the government, and if we have to sue the government, let's sue it.
Thank you so much, Leroy. Absolutely. I think the panelists agree. We have heard from several individuals already, Vivian and Dico, about the importance of education and ensuring that Black disabled folks from the beginning are educated so that we can have so that Black disabled folks can have the support to be able to go through the disaster cycle. If you don't have those initial tools, you're already at a disadvantage. Absolutely. What I'm really, I really want to hear more about, and I think I'm going to turn to Anita on this because you mentioned this as well during the last session, is, when centering Black disabled leadership in local, national, and global emergency management, planning, response, and recovery, the leaders are there. Leroy says, as Leroy said, the leaders are there and we need to listen to them. But for folks who are wondering on, what else, yes, listen to Black disabled leadership, but what does that look like to you, Anita?
Listening to us. Well, my feelings on, if you're truly listening to us, the way it's going to show or manifest itself is that you really listen to what we're saying, take notes, and then implement the things that we're saying. And make it so that things are, are accessible, for us. Like I said, I mean, we're on these committees and commissions, and it is absolutely true that you can't just wait until a disaster to start doing things. You have to plan before the disaster so that you can do things during and after the disaster, in the recovery phase and all of that. But truly hear us, implement the things that we are saying, value us, don't tokenize us, don't put all the work, on us, but then on the other hand, don't give us a little busy work to do. Don't give us busy work to do. Give us real effective things to do, so that we could really, listen to us, do things in a culturally competent fashion. That's another thing that has to happen. Look at the way, I think that it will be clear that people are listening to us when you implement the things, when you listen to us, take notes, implement the things that we say, and do things in a culturally competent fashion. So, I mean, to me, the biggest thing is to show that you heard us, is to put what we say in action, in motion.
Wonderful. That's very similar to what I'm hearing from Leroy. And it really sounds to me that the best way to center Black disabled leadership is to recognize Black disabled leadership. Dika, would you say that's true?
Yeah, I think it is true. I think it very much is true. And building up on what Anita and Leroy have said, also, I think part of the implementation is because I've seen this firsthand here in Nigeria, where I am. My local government decided that it's going to give away scholarships, to disabled students. But the problem was they were not able to identify the target audience. So they put out the scholarship, it's out there, but they said that only 2 people applied and the slots are there, but people are not applying. So I think one of the things that you do if you want to have, you want to send to Black disabled people in local and more general in national politics is, or leadership, is that you need to have them individually within the halls of power, so where power resides. As these decisions are made, for example, the scholarship decision, there's somebody there with a disability that can say or suggest the best channel to make the people with disabilities aware of, the targeted audience, and also do it in conjunction with organizations and associations for persons with disabilities, because this also happened in Nigeria during the COVID-19 pandemic, where relief materials were being distributed. But because associations and organizations for persons living with disabilities were not really consulted, so many people with disabilities were not able to go to the places where these things were being distributed because it was so crowded, and people were pushing other people, and it's not really accessible to someone with a wheelchair. Or even in the implementation of stay-at-home orders, some people were deaf and they were not able to hear when they're being like shouted at, stay at home or blah blah blah. So in terms of the I think in terms of the implementation, it is important to implement them, but also it is important to have disabled people where the decisions are made individually within high positions where the decisions are made, sort of like advisors telling the people in power how to implement these things. Because if you leave it to the government and say, okay, we have written papers and so on, go and read the papers and it will help you, in taking your decision. From my experience, what I found is that it often doesn't work that well. But when you have somebody, and I liked what Leroy said, pressure is important. So also along with that, also keep the pressure. And I think when you have somebody there and the people, the organizations and the people who campaign for these things are also backing him, I think, or them, whoever they are, I think it's going to be very helpful in terms of implementing it.
Thank you so much, Deco. I want to give Leroy an opportunity to respond to that, and then I'm going to turn to Kaman for our last question. Or not our last question, one of our last questions. Leroy?
Yeah, I want to give like a really example, on the ground example, because we can talk about government all day, but really what's on the ground and what people are really doing. So here in the Bay Area, you have the Disability Justice Social Club that really is kicking butt on the ground. During the PG&E outage, they came out with a fund to help other disabled people, and this is people on the ground. So that's number one. Number two is Poor Magazine, and Poor Magazine has this concept called Homefulness, and they are building homes for low income people. And they do this all with no funding. So there's answers on the ground that we need to pick up and bring to the state level and the federal level, because Section 8 is not doing it, HUD is not doing it, and with these emergencies that are happening, we need alternative platforms, especially now if we're going to come out of COVID and we're going to come to a new, different society, then we need some new radical ideas. Thanks.
Thank you, Leroy. And what I really heard from that is the answers are there. We have the answers. The Black disabled community has the answers. So one of the best ways to center Black disabled leadership is recognize Black disabled leadership, listen to Black disabled leadership, and follow Black disabled leadership. That's really what I'm gathering from the 5 of you. So thank you guys so much. Come on, I'm going to turn to you for our next question. And that's, how do we build a culture where truly inclusive and equitable disaster preparedness, response, and recovery is the norm?
Yes. How do we build a culture? It's only it's only when we are effectively participating in the decision-making process. In the designing, when we are talking about disaster, when we are talking about leadership playing the effective role in the leadership, so that our Black disabled people are not missing out in service delivery in terms of responding to whatever disaster that is happening, or right on the spot or in future. So to build a strong culture, it's only when we are participating effectively in the decision-making process. So how do we participate? I think we've alluded to some of the panelists that alluded to that they have to recognize they have to recognize Black people as important as others in the decision-making process, and also to participate in whatever discussions or whatever strategies that they are putting forward, whether it be the government or development partners. So I strongly think that if only we are participating effectively. If we are participating effectively right from the designing of projects, or right from the designing of a disaster, preparedness or response, and planning of things, then we will know, and we will ensure that we can tick the box. If we are not participating all across the cycle, as some of our panelists has alluded to, we will be missing out. So the important thing is to see us participating in the cycle of decision-making process.
Absolutely, that is so important. And it should be noted again, and what I'm hearing from you guys really is that participation is there. It's really important to recognize that participation and encourage other disabled Black folks to participate. So thank you so much, Kaman. Vivian, we haven't heard from you in a while. I want to turn to you. What are your thoughts on how we build a culture where truly inclusive and equitable disaster preparedness, response, and recovery is the norm?
Yeah, so I definitely agree in terms of including us in the conversation. And I think it's also about looking at the wider context. So some of the stuff I was saying before about all the different determinants that might impact our lives as Black folk who are also disabled, is considering all these wider things that might impact us and having that in mind when we're trying to understand and support people. So I think looking at the hierarchy of needs. So if somebody is having a difficult time finding housing, it's not really going to do them justice to offer them a study skills coach for work, because the home they're going to is not stable. So I think it's considering people as an entire person. And sometimes I think with support services, they can just focus on one element of the person and they don't consider the whole. So I think changing that narrative where we see the bigger picture and work across services. So if there's a service that supports women who might be experiencing domestic violence, is there also a service that supports young people, so those children in the family can also get support? So having ways to work together, so there's a community of support around people. I also think there needs to be some kind of I guess in terms of the idea of recovery, we really prescribe to the social disability model. So not placing the problem in us, it's looking at, is society accommodating us? Is it accommodating our difference? And if it's not, then actually that's how we move towards a recovery norm, where it's like, actually, this person isn't the problem. We're just not providing enough space for them. We're not giving them the right tools and resources to improve their quality of life. And I think if we change that narrative, it takes away a lot of shame. It takes away a lot of the kind of fight to get support, because that becomes the standard, that this person needs a leg up. They need they need a helping hand, and that becomes normal. It doesn't become their problem. Yeah, and I think that just needs to be held in mind a lot more, and that can be kind of rolled out across different services. So yeah, I think that's the main thing for me.
Wonderful. Yeah, absolutely. We don't live in a bubble. You know, humans don't live in a bubble, and we don't live with one specific identity. We know that Kimberly Crenshaw has, you know, coined this term intersectionality, and really keeping that in focus is what I'm hearing you say, keeping that idea in focus so that, you know, people are supported in every way they need and not just one specific way. Is that about right?
Exactly, and not placing the problem with them, because the problem is not them. The problem is that there's not enough resources to support their difference.
Absolutely.
Neurodiversity is within the scope of humanity. You know, we exist as a
Absolutely.
percentage. So it's not a problem, it's a difference, and that needs to be heavily included within our thinking and how we set up systems and structures.
Absolutely, 100%. That shift is so important. Deco, I want to turn to you because I know that you have some thoughts on this, specifically on what Vivian said. So did you want to jump in here?
I almost don't want to jump in here because Vivian has said it so beautifully. You know, like changing the narrative and making sure that it's not about like I'm the one with a disability, so I'm the problem, obviously, and I'm the burden. But thinking about, I mean, it's all about having this kind of a more balanced approach to what we want to become as a society. Recognizing the differences that exist, and Vivian talked about this beautifully. So I do not want to hamper on this too much, but I do think it's a very important point, and it's worth emphasizing as much as we can, because the key point that I also want to stress is if we start looking at society as the one, or society as the thing that is not designed well to fit our own, you know, different kinds of abilities, then we start recognizing that, okay, in a school, we should have more accessible learning for students. At a place of work, we should have a more accessible place of work for a person who works there. And also in general daily living, we start recognizing those little bits of, you know, improvements that we have to make in the design of our world. And then when there's a disaster, we don't have to start talking about, okay, how do we quickly evacuate? Okay, now we've evacuated everyone, but somebody's wheelchair is still, you know, up 20 stories. So just leave the wheelchair. When next are they going to have a wheelchair? We don't know, but that's not our problem. So if we start looking at the society where we say, okay, is it really designed to accommodate the differences that we have? Then I think we would have a more better, you know, appropriate and a more efficient response, if you like, to disasters as a whole. But Vivian really did cover it. I'm very excited to be part of this because, yeah, you learn from things like this, and I think it's partly probably the larger point of having these kinds of conversations.
Absolutely. And I want to specifically note here, Deco, that your comments are definitely not only welcome, but highly respected. And I'm so glad you did add your comments, because what I'm hearing from you that, you know, Vivian alluded to is, you know, when we are really actively meaning to support Black disabled folks and other multiply marginalized individuals, we are supporting the community as a whole. We're better supporting the community. Yeah, everyone's needs are going to be met.
That's another aspect of it that I skipped to mention also. You know, accessibility is also a way of even making things better for not just us, but the larger society. Yeah, absolutely right.
Thank you so much, Deco. I really appreciate your thoughts. We have about 2 minutes left. Let me rephrase that. 2 minutes before we jump to the Q&A portion. I do want to get to our last question. And so, you know, we've discussed this during this webinar, as well as a webinar in February. We discussed how racism and ableism really impacts Black disabled people's experiences during disasters, and how it perpetuates, the inequalities within these systems. And so we, GADRA, we are establishing a working group that specifically focuses on ensuring that our work is led by and accountable to Black, Brown, Indigenous, and other disabled people of color globally. And as future members of this working group, which we're all very excited to have you on, what is one thing you want to focus on as we build equitable disaster responses? I'm going to turn to Anita and then to Leroy.
Thanks, but I quickly want to go back on something, and it might even be applicable to this. I'm a CERT, Community Emergency Response Team member. I'm a CERT, I teach CERT, I design CERT programs. When you look at training materials and you don't see people or situations that represent you, that makes you feel like you're forgotten. So in all of my CERT training, I never saw disabled people in the training materials, pictures of us. I certainly never saw Black people, and I certainly never saw disabled people. So, I'm thinking that one of the things that we could be doing, here at GADRA, as we're coming up with things, and whatnot, and designing, and certainly these webinars are a great, response, but if but if we are, for example, if we are designing training materials and things of that nature to reach out to different communities and whatnot, please don't fill it all up with white able-bodied folks. Use, incorporate us in, into that. First off, incorporate us into that training. I would say reach out, GADRA, I think we can reach out to more Black and disabled communities, not only around the world, but in like rural, poor areas, because all of us kind of doing this, we have a measure of privilege. I would like to see us like really reach out to like really poor, impoverished communities, and getting them to be on that ground floor and be at the table in that. And when we're dealing with people with disabilities, don't just include those of us with the privilege to be able to speak or talk or whatnot. I want to see people with intellectual disabilities in on this. I want to see people who are non-speaking or non-verbal in on this. I want to see those people that we usually leave out in the disability community in on this. So I think that, for us, for GADRA, I think we really kind of need to be kind of far-reaching in our efforts. And I think we need to work on some funding, because this is gonna take some money.
100%.
Yeah, there are poor groups and poor folks out there who manage to do this without funding. But I think that it can happen. But on the other hand, don't leave that all to us.
Absolutely.
Because
Anita,
a lot of us don't have that access to money, funding, grants, or anything like that, help us out. So
1000%.
see us, have us, use us in trainings and education, and fund us.
Wonderful. Thank you so much, Anita. That is Yeah, I mean, that is beautifully summarized this event, honestly. And you did, it's actually really interesting. You answered Angie's question, who had put it in the chat, which was, how can we collaborate to create inclusive response and recovery CERT teams around the country? And I really do think you spoke to that, Anita, and it starts with inclusive trainings and inclusive representation. So thank you, Anita. I know that we do have a couple of questions in the Q&A. I want to turn very quickly to Leroy. Leroy, you have about 2 minutes to, I know you had a previous comment, and then to answer the question as well.
Yeah, I'll make it quick. I'll talk about Crip Hop was doing. We have a chapter in Africa, and now we are, going to write a book together about, African people with disabilities in the continent and all over the world. We have to realize that Black disabled people had movements before this crisis. I saw them in UK, in Toronto, in South Africa, and all of them was crushed because of a lack of funding and in white voices supremacy. But I think that we need to tell these stories. About these movements that started out that really nobody's writing about, So that's one thing, telling the stories and getting the stories out there. Yeah.
That's so important. Absolutely. When we don't know the stories that are out there and the experiences out there, it's really hard to address those unequal experiences. Thank you, Leroy. In the next 5 minutes, I want to jump to our Q&A. I'm going to start with Kaman. Kaman, can I ask you, we have a question that says, what should the global effort for inclusive and I am so sorry. Clearly, I need to put my reading glasses on. Let me start over. What should be the global effort for inclusivity and diversity?
Inclusivity and accessibility, is that correct? Sorry. Yeah. It's a progressive realization, not just seeing us as, and I think other panelists alluded to, not seeing us as persons with disability, but seeing us as an important person in the society that can contribute towards the development of the society and the country as a whole. So recognizing the importance of everyone to play in the society, then we can participate. Inclusivity is taken into consideration. Some of the times too, it's good to embrace. Like for me, I come from Papua New Guinea, and our cultural practices, how we carry the cultural practices from our traditional ancestors forward, and we continue that is very, very strong. So it's good to realize that and embrace that, and get it forward and bring it to the table to discuss how do we embrace and realize that you are a person with a Black person with disability, but embracing how you live and how you grow up and how you do things, so that it's part of building that person going forward, and it's part of inclusivity when you embrace everyone equally, despite how they live, how they grew up, and things like that. So it's good to embrace and recognize that, so that you include them.
Absolutely. And perhaps, and I would love to hear your thoughts too, come on, but perhaps it's even, I would dare say, take it a step further and say, people with disabilities are important, period, right? As people, we're important, but we're important. Our perspectives are important to disaster management and recovery, because we are disabled people, right? Because we have that perspective. We are important because of our disability and our perspective. So I'm sure you would agree with that as well. Come on.
Yes, definitely, definitely. And the important thing to realize is, you know, everyone, every Black person with disability are expertise in their own areas. So you cannot be substituted, or you cannot be represented by anyone else. You have to bring that expertise to the table to shape conversations for inclusivity and accessibility.
Wonderful. Thank you so much, Kaman. That is such a such an important perspective. Thank you. So we do have a couple more questions focused on on individuals. I'm happy to share these questions with the panelists themselves because we are at the top of the hour, and I am going to wrap us up. I want to first and foremost say thank you to our 5 panelists. This was such an amazing discussion, and I really truly hope to see you on our GADRA working group so that we can continue this very necessary and important work that we have now and we're doing now. Secondly, I want to thank our access team, the Interpret This team for ASL, as well as our CART captioner, Lori, who is on CART today. So thank you all for your presence and your help today. This event would not be nearly as successful as you all. And lastly, I want to thank the attendees who are here today with us. This conversation really is so vital, and we're so glad that you're here with us to have it. Please stay tuned for the post-production of this video. It should be out within the next couple of weeks. In the meantime, you can view this webinar as well as previous webinars on our GADRA Facebook page, as well as review other material on our GADRA Twitter page. Thank you guys so much, and have a lovely day.
Thank you.